Dr. Ken Landau. Thanks for watching. Let's talk about Norvasc, also known as Amlodipine. This is a drug that's known as a calcium blocker, principally used for high blood pressure control. Came on the market in 1992 as Norvasc and went generic as Amlodipine in 2007. It's on the World Health Organization list of essential medicines. It's used for high blood pressure control. It's used for people who have chronic stable angina from narrowing of the coronary arteries. It's used for people who have vasospastic angina. Vasospastic angina is angina you get while you're sitting down. The chronic stable angina when you're out moving about. And it also might protect the heart if you have coronary artery disease without any kind of symptoms. It's very widely used. About 14 million people take it every day. It's one of the most popular medicines for high blood pressure control. And as a matter of fact, it was the 6th most frequent prescription in 2016, and it's now combined with other medicines. So the pill Lotrel combines the amlodipine and an ACE inhibitor, also for high blood pressure. The pill Caduet combines atorvastatin, also known as Lipitor, with the amlodipine so that it helps your cholesterol and your blood pressure. Seems to work better to prevent stroke than it does to prevent heart disease. And the more you risk, the better the medicine works. So if you have really high blood pressure, the medicine works better than if you have just a little bit of high blood pressure. And that brings up the issue of the American Heart Association, American College of Cardiology guideline change in November of 2017. They said, oh, if your blood pressure is more than 130, you got to do something. Most people say that's absolute nonsense. If you go and do something with a level over 130, between 130 and 140, as they suggest, you're going to get relatively little benefit. So if you have greater risk, the higher the pressure, the more benefit you're going to get. And as a matter of fact, the more risk you have, irrespective of just your blood pressure. So if you happen to be overweight, if you happen to be a cigarette smoker, if you happen to be diabetic, if you happen to have high cholesterol, you'll get more benefit from taking the pill than if you're an otherwise thin individual with only a tiny risk and only a minimal elevation of the blood pressure. So overall, we look at, traditionally, stage 1 hypertension is when the top number is between 140 and 160. Typically, you can take one pill and that will bring your blood pressure back down to relatively normal. If you have stage 2 hypertension, where the top number is more than 160, typically you're going to need 2 pills to start. But you have to remember, the treatment of high blood pressure with a pill is merely that. It is a treatment. It is not a cure. A cure requires lifestyle changes. So if you're overweight, you got to go on a diet and lose some weight. You have to decrease the amount of salt. We all get too much salt. People say they don't add any salt. That's not where you get the salt. The salt's in the food that you eat. It's in the processed food. It's in the can of soup that you consume. It's in the piece of bread that you eat. It's in the pastry. It's all over. Look to see how much calcium. Limit the amount of calcium to somewhere between, hopefully, 1,500 milligrams a day. Can go up to 2,400 milligrams a day, but if you're hypertensive, cut it down to 1,500 milligrams a day. Eat more fruit, eat more vegetables, consume more nuts, get more exercise. If you're a cigarette smoker, you're nuts, but stop the habit. It's awful. It's going to increase your risk of vascular disease, and here you're taking the pill because you want to reduce your risk. If you drink too much alcohol is more than 2 drinks a day for a man, more than 1 drink a day for a woman, then cut back. Remember, the whole purpose of taking the pill, the amlodipine, or any other kind of a pill, is to benefit your health. You can't benefit your health on one hand and try to harm it on the other. The harm is always going to win. Now, if you have high blood pressure, what should you do to start? Most guidelines suggest the best medicine is probably going to be a diuretic. Diuretic like chlorthalidone. Now, most people who are taking hydrochlorothiazide probably doesn't work as well as chlorthalidone. Chlorthalidone was the original medicine that was studied. It was studied in something known as the All-Hat study. And the benefit of that medicine is it lasts all day. The hydrochlorothiazide is going to last about 16 hours. So when you go to bed at night, your blood pressure can go up. But if you take the chlorthalidone, hopefully it keeps it in control. But that's the first choice. What's the second choice? Well, it could be a calcium blocker. calcium blocker like amlodipine, there are several on the market, well, it helps, but it might increase the risk of heart failure compared to taking the chlorthalidone. So it might not be the first choice. How do the calcium blockers work? First of all, they don't do anything to the calcium that's in your bloodstream. So if you measure the calcium before you start taking the pill, measure it after, it's going to be exactly the same. What it does is it changes the ability of the calcium to go from the tissue into the cells, into specifically the vascular smooth muscle cells. The vascular smooth muscle cells are the cells that line your arteries and arterioles. So they can't constrict as much. If they can't constrict as much, they can't push the pressure as high. The heart doesn't have to pump with as much pressure because the room that it's pumping into is more dilated. That's what happens when you take one of these calcium blockers, and that's why they seem to work so well. If you happen to have chronic stable angina, you walk for 3 minutes and have to stop for a few moments because you get the chest pain, then you can walk for another 3 minutes, then you got to stop again. Well, they can increase the amount of time that you can walk without getting the chest pain, so that's very good. And if you have the variant angina, when you're sitting in bed watching the television and you get the chest pain, well, you have fewer episodes in the course of a week than you would if you were taking, say, a placebo. So if we look at people who have documented coronary artery disease, people who already have narrowing of the vessels inside the heart, we're going to find that taking this kind of medicine, amlodipine, is going to decrease the frequency of hospitalization for chest pain, going to decrease the number of revascularization procedures. People who are taking this medicine need fewer stents, fewer balloon angioplasties, fewer coronary bypass surgeries. And it might also improve kidney function by increasing the glomerular filtration rate. And that's what goes down as we get older because of the narrowing of some of the vessels going to the heart, going to the kidney. Well, how much of the medicine should you take? Typically, we begin at a dose of 5 milligrams a day for high blood pressure, but if you have coronary artery disease, typically about 10 milligrams. So if you have high blood pressure, and you start off at 5 milligrams a day, after a week or 2 weeks, if the blood pressure isn't controlled, then you can increase it to 10 milligrams. 10 milligrams will be the max. But if you happen to have liver problems, you might have to start at a reduced amount. So instead of starting at 5 milligrams, you start at 2.5 milligrams. And if you're a child, then 2.5 milligrams is the beginning dose. 5 milligrams would be the max in a kid. If we look at the different kind of amlodipines there are, it gets a little confusing because there's amlodipine bracylate, amlodipine mesylate, amlodipine maleate. For your purposes, it's all the same. Now, how much effect do you get when you take this pill? It's going to make the top number go down by somewhere between 10 and 15 points. So if your blood pressure is 150, and you take the drug, it might go down to 135. Well, that would be pretty good. That, by the way, is about the same amount of reduction that you would get if you followed those healthy lifestyle changes, except if you follow the healthy lifestyle changes, not only is it going to reduce your risk for a heart attack and a stroke and cancer and dementia and a whole bunch of other chronic degenerative diseases, but it's not going to cost you anything. So that's the good news about the diet and the exercise that works exactly as good or as well as the pill. The good news about the pill is that this is a long-lasting pill, and it works as well in the daytime as it does in the nighttime. And it works on standing blood pressure, and it works on lying down blood pressure. And if you happen to have coronary artery disease and you don't have high blood pressure, you can still take the pill. It sort of is like analogous to aspirin. If you don't have a fever, the aspirin isn't going to take your temperature from 98.6 down to 97. Well, if you don't have high blood pressure, this one isn't going to significantly change your blood pressure. Well, remember, the higher your pressure is, the more benefit you're going to get. So people who have moderate high blood pressure do better than people who have mild high blood pressure. And if you have mild high blood pressure, you may well end up having to take multiple drugs. Well, once you take the drug, it's going to peak inside the system within about 6 to 12 hours. and it's going to last inside with a half-life of 30 to 50 hours. So you're going to get coverage all day and all night. 90% of the drug is going to be metabolized to inactive substances. It's going to happen in the liver, and most of it's going to get passed out in the urine. As far as breastfeeding is concerned, no harm. Pregnancy, no data. If you have the liver disease, as I mentioned, you have to be a little careful. If you happen to have significant and severe aortic stenosis, that's narrowing of the valve that goes between the heart and the aorta, if that's the issue that you have, this pill probably isn't going to be for you because it has a tendency to worsen the amount of angina. And also, we know that if you're taking simvastatin, also called Zocor, the maximum dose of the Zocor simvastatin you should take is 20 milligrams because the amlodipine is going to increase the concentration of that drug inside your system. Does the drug have some side effects? Sure it does, but not significant side effects. So most people take the drug, they don't have any kind of problem. Fewer than 2% of the people going to discontinue because of a side effect. And the side effect are, some people get some nausea or indigestion, some people get some fatigue, some people get tired or belly pain or palpitations. Men can get some edema because remember, they're dilating the arteries but not dilating the veins, so the blood gets out to the leg but can't get back as readily. So sometimes the fluid fills up inside the leg, and flushing occurs more commonly in women than it does in men. You have to be a little careful if you're an elderly individual and it's hot, the summertime, you're not getting enough fluid, you get a little dehydrated. Well, your blood pressure can go down significantly in the day, but up significantly when you're lying down. So that's an issue because of the volume loss. There's some withdrawal syndrome that may occur, especially in older women who've been taking the medicine for 6 to 12 months, should slowly discontinue the drug. Not a lot of side effects or interactions. So you can take this one with grapefruit juice, you can take this one with the blood thinner warfarin, you don't have to worry about taking it with an antacid, and as a matter of fact, the only times you seem to have to worry if you're taking Biaxin or clarithromycin, or if you're taking Valium, well, that might boost the amount of amlodipine in the system and then make your blood pressure go down too much. How much does the drug cost? Not very much at all. Actually, if you go to Blink Health, you can get the first month free and subsequent months are less than $7. If you go to GoodRx and you pay cash, it's only about $15, or with a coupon, as low as $3. But if you happen to want to go and take the Norvasc because you don't want to take a generic drug, it's going to cost you almost $200. So $200 or get it free. I think that's a no-brainer. But remember, we all have a tendency to think, have high blood pressure, going to go treat it with a pill. No. If you have high blood pressure, treat it with diet and exercise. Cut down the amount of salt that you're consuming, more fruit, more vegetable, more nuts, more whole grains. Read the labels, find out how much sodium you're consuming. And if you do that, you might not even need the high blood pressure pill, or if you need the high blood pressure pill, it'll work better, and you get a significantly number of greater benefits, if you happen to follow an appropriate lifestyle. And remember, high blood pressure is extraordinarily common in our society, in primitive societies without our kind of diet where they get some exercise, almost unknown. Thanks for watching. I'm Dr. Ken Landau.